We are back with another All About You, and today I am here alone. Yes, you who follow us have probably seen an announcement from Damian on our Facebook page, and today we are going to discover together what Damian does.
Hello everyone, so I'm here at the Monteiro Clinic and I'm about to meet Osteopath Damian Moore. You've been seeing his teaser all week long, so now we're about to find out exactly what he does, and he's going to be answering questions for you. So are you ready? Many people may not understand what an osteopath does, so can you please explain a little bit more about this field of medicine?
Absolutely. So osteopathy is a system of manual musculoskeletal medicine. So basically that means I use my hands predominantly to move your body around, create change in your body, more often than not working with muscles, joints, but also working to improve the blood supply to areas, improve the drainage of toxins away from an area as well, and through those sort of processes we can also affect nerves as well. So you can actually affect really quite an awful lot of somebody's well-being through working on their joints and their muscles, etc.
How long has osteopathy been recognized as a field of medicine?
Okay, so osteopathy has been around since the late 19th century. In the First World War, particularly in America, it was very popular because you can imagine, we didn't have antibiotics then. So as well as treating the bones and the joints and the muscles, we were able to affect people's healing responses. And so when they had the flu epidemic, patients that were treated by osteopaths had a much better recovery rate than patients who weren't. And actually it's interesting because there's now some research going on in America talking about whether we can actually mix and match, have osteopathic treatment plus antibiotics together to do that. But most osteopaths in the UK practice predominantly on people's joints and bones these days, and for a long time we were seen as very alternative, but recently I think we've been seen as a bit more mainstream, a bit more complementary. So for example, NICE, the National Institute for Clinical Excellence, has published research on low back pain where it recommends, amongst other treatments that used to be considered alternative, it recommends osteopathy, and so you might even, if you're very lucky, get referred to an osteopath by your GP.
Is osteopathy regulated?
Everyone who wants to practice as an osteopath has to register with the General Osteopathic Council. They check, first of all, that you've had appropriate training, that there isn't anything in your background that suggests that you're not a fit and proper person to work with people. You have to have it's not called Criminal Records Bureau check anymore, but a check to make sure that you haven't got anything that says you're not fit to work with vulnerable people or children. You have to be insured. So there's quite a lot there that a lot of hurdles you have to jump through in order to be called an osteopath.
And how would I be able to recognize a registered osteopath? So how do I make sure that my osteopath is registered?
Okay, so anyone who calls themselves an osteopath but isn't is breaking the law. It's a criminal offence to do that, same as it would be to call myself a dentist or a doctor or what have you. But there is a little symbol that the General Osteopathic Council give us, which we can put on posters, flyers, what have you, which has our number on it. Or you can go to the General Osteopathic Council website and you can look on there and search for an osteopath via their website, and they'll only have registered osteopaths on there.
All right, perfect. So in case you're worried, hit the website. And what training does a registered osteopath have to undertake?
Okay, so training for a registered osteopath is 4 years in the UK, of which the last 2 years we're practicing on patients as well as continuing our learning. It's quite an intensive learning process. I did a degree before and I can tell you it was a lot harder than doing that.
He's got 2 degrees, I'm impressed.
Yes, it is a very difficult thing to do, but it's very rewarding, very enjoyable course, really, really good.
What led you to choose to specialize in this field?
I went to university the first time and I dropped out, I had glandular fever. And then I found myself a little job working as a civil servant, and then this career just sort of wandered its way off there, and suddenly I found myself in my mid-30s and doing something I hadn't planned to do, but it was okay. But it wasn't the thing I really wanted to do. And then when, as happens to so many people these days, I got made redundant, I thought, okay, what do I really want to do? And I'd been to an osteopath when I had a bad neck and shoulder, and I hadn't been able to fix it with anything else, and it fixed within about 3 or 4 treatments with the osteopath. And funnily enough, when I was making my decision what to do, I then had another bad back problem, and I went to the British School of Osteopathy for treatment there. And I just happened to be there just before they were closing the intake for the next year. And having been there, it's like, oh, I remember this. I've always wanted to do this. It's fantastic. I applied and I was really lucky and got in. So yeah, really good.
Very interesting story there. How long have you been practicing?
Okay, so I've been qualified just 1 year. But as I say, we do practice for 2 years on patients supervised before that. So we come out ready to practice, basically, because as you can imagine, you're treating other people's bodies. Yeah. You have to be competent to do it when you come out. So yeah, it's been a really good year.
Are you enjoying it?
I love it.
So you're not going to change the career anytime soon?
No, not planning to.
What are the common conditions that you treat?
Okay, so most people, I think when they think about osteopaths, if they think about us at all, they tend to think about back problems. So we do treat an awful lot of people with back problems. We treat people with a lot of neck problems as well. I mean, you can imagine that people sitting at desks these days quite often sat there, neck craned forward, shoulders forward, perhaps haven't had their seating adjusted or their table adjusted so that they're at the right height. Quite often we get people come in with neck problems and perhaps even headaches related to those neck problems as well. I get patients with shoulder problems, patients with knee problems, patients with, sometimes we can help people with sciatica. So sciatica can be called, what we call sciatica can be caused by a number of different things. If you've got a prolapsed disc, I may not be able to help it. You may just have to wait for that to go away. But sometimes people think they've got a prolapsed disc and they haven't. They've got something else that's causing the problem instead. So we get quite a lot of people with that as well.
So what is a prolapsed disc?
Okay, so in your spine, between each of the vertebrae, there's a cartilaginous disc, a disc made of cartilage. And in the middle of it, it's got like a soft centre. So you can imagine it's a bit like a locket suite. And sometimes we can tear or injure that hard outer cartilage, and some of the squishy centre can squeeze out, and as it squeezes out it can press on the nerves, because between each of your vertebrae you have a pair of spinal nerves that exit, and another pair that also pass across. It can cause pain in the area of your skin that is supplied by those nerves.
I was about to say it sounds painful.
It is. It can be very painful. It can be very painful indeed. Unfortunately, it's something we can't, once it's bulging out, we can't make it move back in. But what we might be able to do, for example, when these things happen quite often, it causes a lot of muscular spasm around the joint. So we can work to reduce that muscular spasm. Sometimes you've got a little bit of irritation of the nerve here. So sometimes by working on the other things, we can just reduce the level of irritation enough that you won't any longer have the pain in your leg. So that's what we aim to do.
Good news. Do you treat a lot of sports injuries?
I do treat quite a few sports injuries. I've had a good triathlete coming to see me at the moment. Another very keen cyclist.
In general, how long do treatments last?
Okay, so my treatments, which I think are fairly typical, first treatment would last about 75 minutes. 60 to 75 minutes, because in the first treatment I'll take a full case history from you as well. So I'll ask you all about the problem that you've got, and how it happened, what makes it better, what makes it worse. And from that, I'll start to be building a picture in my mind of what structure I think is probably causing the problem, or structures are probably causing the problem, and what kind of process it is, whether it's inflammatory or not. And then I'll also take a very detailed case history, asking you all about your health history, things that perhaps don't seem directly related to the problem that we're looking at, but that allow me to exclude any systemic conditions, or probably exclude any systemic conditions that are underlying it. So making sure that it genuinely is just a musculoskeletal mechanical problem and not something, not a manifestation of something else. So for example, problems in the abdomen often refer to the back, because the nerves that come out to supply the viscera, the stomach, the abdominal contents, the stomach and other organs, they come from the back.
Now you understand a little bit about what an osteopath does. As you can see, this field of medicine has been around for many years, but not many people know about it. Sabrina went to the streets of London to ask people more about this. Have a look at what they had to say.
Yes, Claudia, we are here in the streets of London to find out if people know what an osteopath does. So let's see what kind of answer we will get, okay? Let's go. So do you know what an osteopath does?
Well, not really, but I think it's alternative medicine. You know, something to do like, it seemed like acupuncture. What else would I say? Is it to do with more or less using the hands and massaging and things like that?
So what do you think an osteopath does?
An osteopath either looks after your feet or your eyes or your ears. But I don't think it's any of those. That's it, I'm afraid.
So do you know what an osteopath does?
I think so. I think an osteopath looks after bones in somebody's back, so they help realign the bones in somebody's back if they have any back pain. Yeah, something to do with the bones.
Well, many did not know much about this field of medicine. So, what can an osteopath do for you? Damian teaches us how to correct bad habits we have and answers some questions for us. Let us follow.
When patients come for their first treatment, what will they need to bring along with them? What should they wear?
Okay, it's really useful when patients come for the first treatment if they do have a list of any medications that they're on. Then if they come prepared for a postural evaluation, that's really useful. And what that means basically is that if they I'd like to look and see if there are any asymmetries, anything odd going on with their body, or just look at how their body works to get functions together. And the best way to do that is with the patient in their underwear. So if they can turn up in some sort of smart, decent underwear.
We get it. Nothing with holes.
Yeah, nothing with holes, nothing too brief.
Cover it all
I
up.
prefer not to. I have gowns which I provide if someone would prefer to have a gown. But it does make it easier if I can just see. And quite often it's only the first treatment where somebody will have to dress down all the way to their underwear. And then usually after that, particularly if it's an upper back problem or what have you, then obviously keep trousers or what have you on. And certainly if they want to bring shorts rather than underwear, that's fine.
All right, perfect. So is osteopathy suitable for children and infants?
It is. However, I don't practice as a children's osteopath. There's special training that you can do, postgraduate training that you can do to become registered as a children's osteopath. So I believe that you should undertake that training. I don't believe it's obligatory, but I believe you should undertake that training before you treat children. That's my thoughts.
We understand that you're a private clinic, but does the NHS ever cover osteopathic treatments?
Yes, but less so because the changes in funding that they've undertaken in the last 4 or 5 years mean that they tend to want to buy services in from larger groups, and physiotherapists tend to work as larger practice, so quite often they'll go to physiotherapists, whereas osteopaths tend to work as sort of one-man bands, so to speak, or smaller groups of people. So it's always worth asking your doctor if it's possible. Some doctors will have an arrangement whereby it is possible, but it is unusual.
How important is it that for patients to have regular maintenance treatments? Is prevention really better than cure?
Well, I think for many people, they don't need to have the prevention because they're okay. But I think if you have got a problem that keeps recurring, or alternatively, if you do things with your body that require a really put a lot of demands on your body, then in that case, absolutely, an agreed maintenance treatment on a regular basis, whether that be monthly, whether that be 3 monthly, is really useful. And certainly for things like osteoarthritis in, for example, the hip, one of the problems people have, and one of the reasons it progresses, is because as it gets worse, people naturally don't use the joint to the end of the range because it becomes a bit painful, and because the muscles around it become very tight and it becomes very difficult to do that. But joint health relies on us using the joint. So if you don't go to end of range, every time you're missing out a whole area of the joint, then potentially that's the next bit that's going to become damaged and diseased. So for patients with osteoarthritis, if they can, it can be really useful to come in for a regular treatment. You're perhaps not going to get better, but you might not get worse. Exactly.
All right. And what precautions should people take when they're using smartphones and laptops, because we live in that generation, and you just mentioned that it can actually affect your body.
Absolutely. Okay, so smartphones, I think just try and be mindful that you're craning your neck forward. Try not to walk into any lampposts. It's really, I'm sure I do it as well. But laptops, naturally the screen is not as far away from the keyboard as it is with a desktop computer. So it's more difficult with a laptop to get yourself in the right position. But if you can, when you're sitting and working, as much as you can, you want your knees at 90 degrees, you want your elbows at 90 degrees, you want ideally something supporting underneath your wrists, because a lot of people get repetitive strain injury. Again, that's something else that people come to me with. And then you're going to have to put up with the fact that the screen is a bit lower than perfect. If you've got the option of plugging in a separate screen when you go into the office, do it.
Okay, you've just given me lots of advice there. I'm going to get my posture right. And what are more common symptoms that will alert people that something is wrong and they need to seek you out?
It's usually pain. People usually come with pain. But stiffness that you're not used to. It's a change. When something changes and you're not able to do what you want to do, or what you are doing is causing you discomfort that you wouldn't have before, then that's a really good time to give me a call.
And something that we were talking about off camera, something that happened with me is if you go for testing, normally with your GP, and there are limited tests that they can perform on you, and those tests come out normal, but you can tell that something is really wrong with you, then don't sit at home and just say, okay, my tests are saying I'm normal, but I'm feeling like this, and let the problem get worse. Do seek out help, and sometimes alternative medicines and alternative practices are very good for that. All right, and now, oh my goodness, we're almost to the end. Our last final question. What is your most memorable success story?
Okay, so I have a patient, and he had a nocturnal epileptic fit, and he came into me, and he was using a stick, because after he'd had his fit, his back all seized up. It was just really great to see after 2 treatments that he walked off down the road holding his stick up rather than using his stick. And I happened to bump into him at the bus station with his friend, and his friend turned around to me and said, "That's just amazing. I can't believe the change in him." And you know, it's a process. I mean, it's that thing if you get the 80% and then the 20% is taking longer, and it's taking a long time to get him completely right. But that was a really nice thing to see. It was really good, really good.
Damian, the miracle worker.
It was a miracle.
Thank you so much for sitting down with us and answering all our questions so patiently, wasn't he? Even though for some things he had to explain himself a lot because Moti over here couldn't understand the medical terms. If people were interested to book an appointment with you, how do they go about doing that?
Okay, well, where we are at the moment, we're sat at the Monteiro Clinic, so you can either call the Monteiro Clinic, which is in Oval. I practice here on a Wednesday and Friday morning, and on a Thursday evening after 5, or you can give me a call on my mobile. That's fine. It's 0786 316 8756.
Are you sure? You're give out your mobile? It's only for booking appointments, okay?
It's on my website anyway, so yes, you're more than welcome to call if you want to do that.
All right, thank you so much, Damian. That was really lovely. And now back to you, Claudia, in the studio.
Thank you, Damian, for answering all our questions. As you have heard, sometimes we need to dig a little bit more to resolve our problems. You know your body. If you notice anything wrong, don't give up on finding the solution. The same applies inside of you. If you are going through a problem, you cannot leave it unresolved because it will only get worse and will hurt you more. Maybe you need help. Well, we have come to the end of our program today, but we would like to leave you with this special invitation of where you can find help. Watch this video and see you next week. Bye.
In life, we women go through many struggles, and who better to understand them than another woman? This is why this meeting is all about you. We hold friendly, light-hearted meetings which equip women with the tools they need to recover and retain control over every area of their lives. Join us every Sunday at 5 p.m. at the Rainbow Theatre. For more information, call 020 7686 6000.